So I can imagine a lot of our audience will hear hospitals get paid more the more things they do to a patient. That doesn't sound like a system that promotes honesty from doctors. Is that something people need to be concerned about? So on one hand, your doctor has the Hippocratic Oath, and they are there to do no harm and to ensure that the patient does as well as possible. But at the same time, there is this mechanism that is in place that the more things they recommend be done to a patient, the more money that is being made. Is there a conflict there?
Implicit in your statement is that the physicians who are making those decisions don't have good values. And actually my experience is that they do have good values. Having said that, perhaps because of advertising like from the pharmaceutical industry, patients come into an office demanding a particular test or a particular drug because they've heard about it. They put so much pressure on the physician that the physician might say, I don't really think you need it. And the patient says, but my insurance will cover it. And so you will have people, in order to satisfy the needs of their patients, wind up saying yes. So I think there are pressures to do that, but I do not see, at least in our community, people who are increasing the number of tests or procedures or activities per patient. I do see a lot of activity on our part to try to help other people come to our care delivery system, because we work at keeping people healthy and out of the hospital. We think more people might want that. And so we don't feel bad about attracting more people to be healthier and come to our community.
You can imagine how, taken out of the context of healthcare and put in anywhere else, to auto repair, for example, that the idea that this incentive exists to do as many things as possible to your car, as opposed to how well is your car running, would be a huge concern for people. So in your experience, there is no, what's the word I'm looking for? Atmosphere or structure where from the top down, there is the idea that we want to be doing more things to patients. That's not something that, in any of your experience talking with other administrators, that you don't believe exists in hospitals.
Well, your analogy is a little bit off, because it isn't the incentives and the way they hit us as providers or car mechanics or any other field, because in all of those fields, even a car mechanic, the more things they can find, the more things they're going to get paid for.
Right.
The difference is that with insurance covering this, it's made people immune to the economics of their choices.
I follow.
And so it's that lack of an economic logic for people that leads somebody to come into a doctor's office and say, I saw this pill on TV, I want it.
And we're speaking with Craig Melin, President and CEO of Cooley Dickinson Hospital here in Northampton, Massachusetts, where we do our show. In what way is there this penalty that's in the system?
The typical hospital in Massachusetts spends 1% of its budget on prevention. Cooley Dickinson spends 3% of our budget on prevention, or $5 million. The impact of that is that our costs are higher per person because we're spending money to keep people out of the hospital and healthy. Insurers come along and say, please drop your prices. They may be less polite than please, but they say drop your prices. If you need to drop your prices, you need to drop your costs. If you drop your costs, the easiest cost to drop is the prevention. If we drop our prevention, actually in the current incentive system, we look great financially, because then everybody will get sicker, we'll have more patients, and we get more revenue.
Right.
So as a hospital trying to hold the line and saying, we believe in moving to the future state where the health of people is important, we're trying to preserve as much of that $5 million investment in keeping people out of the hospital in the first place, taking care of diabetics so they don't need to be admitted, avoiding readmission and congestive heart failure, avoiding infections and complicated care. All of our investment in that raises our cost per service, and yet the pressure is on price per service, with little attention, if any, to how much less people need care in our community because we're keeping them healthy.
There is no benefit to the hospital when there is any kind of review done or any analysis of keeping people healthier, is essentially what you're saying.
People say, nice job.
Right.
And they say, of course your values will keep you doing that, but in the meantime, the prices get ratcheted down, and the cost of keeping people healthy is why our prices might be higher than they otherwise would be.
We've been speaking with Craig Melin, President and CEO of Cooley Dickinson Hospital. Thanks so much for coming in today.
Nice to meet you.
You've been listening to Midweek Politics with Dave Pakman.
Midweek Politics is brought to you in part by Jackson & Connor, classically modern men's apparel in Northampton, Massachusetts on the second floor of Thorne's Marketplace, and by DIF Design, specializing in custom business websites at difdesign.com. To find out more about underwriting Midweek Politics, visit midweekpolitics.com.